What happens to your health insurance when you turn 65 and you're working for a small company? If you're unsure whether you need Medicare or you're worried about your family's coverage, today we will clarify exactly what you need to know and what steps you need to take to avoid mistakes. I'm Cameron Giardini from Giardini Medicare, and today we are going to walk through everything you need to know about Medicare if you or your spouse work for an employer with fewer than 20 employees. We have another video specifically for those of you that are working at large employers, which again in this case is 20 plus employees. So make sure to watch that video if it applies to you or somebody else that you know. When it comes to working past age 65, the rules change dramatically when your employer has fewer than 20 employees.
You keep changing the rules.
And these changes can have major financial consequences if you don't fully understand them. First, we will briefly look at when you become eligible for Medicare. Then we'll tackle the critical question of whether you actually need to enroll in Medicare at 65 with small employer coverage. We will explore how Medicare coordinates with this small employer health insurance. We will compare costs between your options and address what happens to dependents on your plan. By the end of today's video, you will have a clear roadmap for making the right Medicare decisions without confusion. Before we get started, please make sure to scan the QR code that you can see on the screen or use the link in the description to join our private Medicare Q&A Facebook group. It is a great place to get answers to specific Medicare questions, and of course, you can also comment any questions you have below. A vast majority of people first qualify for Medicare when they turn 65. There are exceptions for disability or certain health conditions, but today we will focus specifically on those of you turning 65. For those of you first eligible due to turning 65, most people are eligible for Medicare the first day of the month they turn 65. For example, if your 65th birthday falls on September 18th, you become Medicare eligible on September 1st. Here's an important exception to this rule. If you're born on the first day of the month, you actually become eligible for Medicare 1 month earlier. So someone born on September 1st, they become Medicare eligible starting August 1st. Now let's address a question that you probably have on your mind. Do I actually need to enroll in Medicare when I turn 65 if I have employer coverage? It is very easy to get caught up in YouTube videos about Medicare Advantage plans versus Medigap plans, but first let's take a step back and determine if you actually need Medicare right now. If you're turning 65 and covered by a group health plan, which you can see the definition of here on the screen, this will come down to 3 key factors. Number 1, the employment status of you or your spouse. Number 2, the size of the employer that is providing the group health insurance. And finally, whether or not your prescription coverage through the plan is considered creditable for Medicare Part D. We will break down each of these right now. For employment status, you need active employer group health coverage either through your current employment or a spouse's current employment. And this is so you can delay Medicare Part B without penalties. Be careful here because COBRA coverage, retiree insurance, individual health plans like through the health insurance marketplace, and even VA coverage do not count as active employer coverage. And that's great and all for penalties, but the most crucial factor for our discussion today is employer size. Here is where things get particularly important.
I'm listening.
Once you become eligible for Medicare, it becomes your primary insurance if your employer has fewer than 20 employees and is not part of a multi-employer plan with other larger companies. In this case, your employer coverage, it becomes secondary to Medicare, which completely changes the game.
Change the game.
Change the game.
To be clear, if there are fewer than 20 employees at the employer providing your group health plan, you generally must enroll in Medicare when you turn 65. This likely is not optional if you want proper coverage. It doesn't mean you're forced to leave your employer plan, but again, Medicare will become your primary coverage going forward, with your employer plan providing secondary coverage. On the screen are actual letters that people have received from their small employer insurance plans, clearly stating that Medicare must be their primary coverage at 65. Without Medicare enrollment, your employer plan, it can refuse to pay claims that should have been covered by Medicare as your primary coverage, or the employer plan might just pay a small portion of the bill leaving you with potentially devastating medical bills. How is this employer size determined though? The count includes both full-time and part-time employees, and we will link to specific Medicare guidelines for how they determine specific employee counts. However, you should always confirm employee counts and whether or not your employer coverage will be primary or secondary to Medicare directly with your employer or group health plan. This is not something that we as brokers can determine for you with 100% certainty. It's also worth mentioning that in rare cases, a small employer plan, it may agree to remain primary even if you don't enroll in Medicare. However, unless you get this confirmed in writing and you verify it in your plan's summary plan description or the SPD, this is not something that you should risk in our opinion. Also, for those of you that are first eligible for Medicare before 65, just know that the magic number of employee size becomes 100 instead of 20. The third factor to consider is whether your group health plan's prescription drug coverage is creditable for Medicare Part D. This just means that your employer prescription coverage is expected to pay, on average, at least as much as Medicare drug coverage. This determines whether you can delay Part D enrollment without penalties. Your employer generally must provide an annual written notice confirming if your coverage is creditable. We will show examples of these notices on the screen, but again, you should always check with your company in writing just to be sure. When you enroll in Medicare at 65 while having employer group health coverage through a small employer, expect to at least pay the Medicare Part B premium, which is $185 per month in 2025, at least for the base rate. High income earners, they may pay more due to the income-related monthly adjustment amount known as IRMA. This is based on your modified adjusted gross income from 2 years prior. These IRMA adjustments, they also apply to Medicare Part D coverage. You may be able to appeal these surcharges if your income has recently lowered, but this does tend to be less common while you're still working, since it's probably uncommon your income has lowered. This brings us to an important comparison. How do you evaluate whether to keep your employer coverage as secondary or move on completely to other Medicare coverage options like Medicare Advantage or Medigap and Part D? When making this decision, you'll want to compare total costs and coverage. Look at your current premiums, deductibles, and copays for your employer plan. Then compare those costs to what you would pay with either Medicare Advantage or a Medigap plan with a Part D prescription drug plan. Remember that the Part B premium is a constant in either scenario. You'll pay it regardless of which path you choose, so when you're comparing all of these costs, focus on the additional premiums and out-of-pocket expenses beyond the $185 monthly Part B cost. Doing these comparisons is generally pretty easy and straightforward, but what about dependents? This is where things can get especially complicated.
You can get off your parents' health insurance.
If you're covering a spouse or children on your current plan, switching to Medicare will likely impact their coverage options as well. Let's look at what this means for you and for them. Unlike large employers, small employers with fewer than 20 employees, they are not required by federal law to offer COBRA continuation coverage. While some states that you can see on the screen and that we will link to have mini COBRA laws and this might apply, this will vary widely by state. Even when this option is available, expect to pay 100% or more of the total insurance premiums if you elect to continue coverage through COBRA. Generally, your dependents have 3 main options. Option 1, if you remain enrolled in your employer plan with Medicare as primary, they can remain enrolled in your plan just like they were before. Option 2, they can purchase individual health insurance, such as through the health insurance marketplace or other options. And finally, option 3, if they are currently working at a different employer, they can see if their employer's health insurance could work for them. As an added pro tip, if your spouse happens to work for a large employer with more than 20 employees, it might be worth seeing if it makes sense for both of you to change to their plan and delay Medicare beyond age 65. Again, if this applies to you, please make sure to watch our 20+ employee video guide. Let's make this more concrete with two different examples. First, meet Jim, who is turning 65 and currently covers his 57-year-old self-employed wife, whose name is Carol. And they have their 24-year-old son, Hunter, who is also on the plan, but he did recently start at a job that does offer health benefits. Their current family coverage costs them $515 per month. When Jim does enroll in Medicare Part A and Part B, which again he must do because of the small employer size, he will add $185 per month for Part B premiums, bringing their total to $700 monthly. If Jim decides to leave his employer plan entirely and switch to a zero premium Medicare Advantage plan, he would then only be responsible for paying his $185 per month Part B premium. But this creates a domino effect. Carol is not offered COBRA coverage based on the state that they live in, so she would need to look for individual marketplace coverage at approximately $600 per month based on her age and income. And Hunter, he would pay about $150 per month through his new employer plan. Now, if Jim does switch to that Medicare Advantage plan, their combined monthly premiums jump to around $935 per month. So if we just look at premiums, keeping everyone on the employer plan, it does seem cheaper. But of course, there is more to consider than just monthly premiums. If and when you have to make these decisions yourself, please do not forget to compare the out-of-pocket medical costs between employer coverage and Medicare options. If we just look at an individual comparing these costs for monthly premiums in 2025, we see that Medicare Advantage plans, they generally have a $0 per month premium. Medigap Plan G typically runs between $80 to $150 per month, and the average individual employer premium is about $115 per month. As for out-of-pocket costs, when it comes to deductibles, Medicare Advantage plans, they typically have deductibles that are about $0 to $250 per year. Medigap Plan G has just the Part B deductible of $257 in 2025, and smaller employer plans average around $2,500 per year for an individual deductible. For maximum out-of-pocket costs, Medicare Advantage out-of-pocket limits are around $5,500 on average in 2025, although the upper limit can be much higher. With Medigap Plan G, your maximum out-of-pocket for Medicare covered services is the $257 Part B deductible, and then employer plans, they typically have out-of-pocket spending limits of about $3,000 to $6,000 per year. Let's look at another example to make things even more clear. Michelle and Ted are married, with Ted covered under Michelle's small employer plan at a law firm. They currently pay $300 monthly in combined premiums, $100 for Michelle and $200 for Ted. Their plan has a $2,000 deductible and a $4,000 maximum out-of-pocket limit. As Michelle turns 65, she enrolls in both Part A and Part B of Medicare, since again, she works at a small employer, but Michelle has chronic health conditions that often cause her to approach or reach her plan's maximum out-of-pocket limit each year. Ted, on the other hand, he rarely needs medical care. After reviewing their options, Michelle, she opts for a Medigap Plan G and Part D prescription drug plan with total monthly premiums of $150. And of course, this is in addition to what she pays for Part B. Meanwhile, Ted, he enrolls in an HSA eligible high deductible health plan through his own small employer at $100 per month with a $3,000 deductible and a $6,000 maximum out of pocket. This arrangement, it works well for their specific situation and healthcare needs. Michelle now pays slightly more in monthly premiums, but has predictable low out-of-pocket costs with the freedom to see any provider accepting original Medicare. Ted now pays slightly less than before in monthly premiums, and he has a higher deductible, but one that he rarely reaches, and now he does have the ability to contribute to a health savings account. When comparing Medicare and small employer coverage versus Medicare Advantage and Medigap options, there are also some less talked about factors that we think are very important for you to know. First, one of the most challenging aspects to understand is how Medicare coordinates with employer coverage when you have both. This is called the coordination of benefits. When you have Medicare as primary and employer coverage as secondary, figuring out actual out-of-pocket costs can become complex. The exact coordination between Medicare and employer plans, it depends a lot on your plan's specific rules. This is not something that we as brokers can usually determine for you. You will either need to contact your employer or again reference your plan's summary plan description for the exact details, and even then, it can still be difficult to determine. However, as a hypothetical example, let's assume your provider bills $4,000 for a service. Medicare approves $2,000 of this amount, while your employer plan would normally approve $3,000. Assuming you've paid the Part B deductible, with Medicare as primary, it pays 80% of the approved $2,000 amount, which is $1,600, leaving $400 remaining. The employer plan then might pay 70% of the remaining $400 based on this particular employer plan having 70-30 coverage for this example. This would leave you responsible for the final 30% of the $400, which is $120 out of pocket. But another scenario might play out differently. If your employer plan would have paid $2,100 as primary, which again is 70% of the $3,000 approved amount, then as secondary coverage, it might simply just cover the entire $400 after Medicare makes its payment, since it is still lower than what the employer plan would have paid before you became eligible for Medicare. In contrast with a Medigap Plan G, once you've paid the annual Part B deductible of $257, your out-of-pocket cost for Medicare covered services would be $0. And if we look at Medicare Advantage, instead of a percentage like a coinsurance, you usually have set copays for services. In this case, perhaps $250 for an outpatient surgery.
So what does this mean?
The point of this is to say that comparing secondary employer coverage to Medigap and Medicare Advantage plans, it is not as straightforward as you think. Prescription coverage is another important consideration to think about. In the past, some people with very expensive medications, they would find lower out-of-pocket costs with their employer group health plan, making it worthwhile to have as secondary coverage, simply to help with specific medication costs. But starting in 2025, as you probably know, Medicare prescription drug coverage, both through Medicare Advantage and Part D plans, has a $2,000 yearly cap on out-of-pocket prescription costs for medications that are covered by your plan's formulary. This significant change, it can make Medicare prescription coverage more appealing to some, but just know that this cap, it is subject to change due to legislative changes that may or may not happen in the future. But that's not to scare you. We haven't seen anything suggesting this will change anytime soon. Thankfully, for now, you can estimate your prescription costs and what they would be with Medicare drug plans using the video that we made and that you can see here on the screen. Lastly, also be aware that if you are banking on prescription copay cards for high-cost medications, the eligibility for those plans typically terminate once you're enrolled in Medicare prescription drug coverage. You can see that this applies to a common discount card that many people with Eliquis use. Just know that that does not mean you can't get patient assistance with these medications. It's just that you probably can't use those copay cards you may have been using in the past. Now let's discuss a very critical timing window, which is your Medigap Open Enrollment Period, or OEP. This starts the first month that you have Medicare Part B and you're 65 or older, and it lasts for 6 months. You can enroll during this time period in any Medigap plan letter that you are eligible for, and you can do this without answering health questions or worrying about medical underwriting. Here is something crucial you have to understand. This 6-month window, it starts when you first enroll in Part B at 65 or older, regardless of whether you actually use it to enroll in a Medigap plan. It is a use it or lose it opportunity. For example, if Jane turns 65 in October 2025 and she enrolls in Part A and B October 1st because she has a small employer plan, her Medigap OEP, it runs from October 2025 to March 2026. And again, this is even if she keeps her employer coverage as secondary and does not enroll in Medigap right away. If you leave your employer coverage after your Medigap OEP ends, you will still likely qualify for Medigap coverage on a guaranteed issue basis, due to losing group health coverage. However, these guaranteed issue rights are more limited than those available during your Medigap OEP. For instance, insurers are not required to offer Medigap Plan N on a guaranteed issue basis. So you will likely need to go through medical underwriting to get approved for that plan, and then coverage is not guaranteed. Last but not least, what about health savings accounts? Once you're enrolled in any part of Medicare, even just Part A, you can no longer make contributions to a health savings account. This includes contributions from your employer or anyone else on your behalf. If you do need to enroll in Medicare when you turn 65 due to having small employer coverage, you'll need to stop HSA contributions accordingly. You can still use existing HSA funds for qualified medical expenses even after you enroll in Medicare. You just can't add new money to that account. Thankfully, we have a complete Medicare and HSA video for any more details you might need to know. Remember, once you understand how Medicare works with small employer coverage, your next step is deciding whether to keep your employer plan as secondary coverage or switch entirely to Medicare Advantage or Medigap. Each option has different costs, different benefits, and considerations based on your specific healthcare needs and financial situation. To learn more about Medicare Advantage and Medigap options, make sure you watch this video next.